We're back to horrible traffic again.
Oh, I know where
Driving.
that is exactly. It's like
Yeah.
580, 880 merging to becoming 80.
Yeah.
I
Are
think
you
I
guys
go
all in the Bay
Monta
Area?
Vaca.
Is this? Are you guys in the Bay Area that we're on the call with?
Yeah, we're all located in the Bay Area so far. So we are 5 minutes in. We're just going to go ahead and get started and let everyone join us as they see fit. My name is Leticia Vaca. I am the founder and CEO of Urban Health Group LLC. Our talk tonight will be about keeping elders safe and our options for care. So it's a really timely talk with May being Older Americans Month, and a lot of things that we're seeing around in our community and also within our families directly. So a little bit about me. Like I said, I'm the founder and CEO of Urban Health Group. I help Black, Indigenous people of color plan well for medical emergencies and all other things connected to their both physical health and mental health. I also co-own a multicultural group practice providing psychotherapy. I've been in the field of human services, mental health, nonprofits, for-profits for over 15 years. But my own experience with lost family members and friends really informs my work. So it's not just that I have a master's and I'm a licensed therapist, it's really that I've been affected by loved ones who have lost their life prematurely. And I want to be able to provide support to folks who find themselves in a hard place. My specialty is trauma and medical psychotherapy, but I ultimately just like supporting people with day-to-day life difficulties. I believe in communities, I believe in people, so I'm really happy to hold space and talk about some really serious issues and also offer some supports. In our time today, we'll be talking about some common reasons that elders find themselves in the ER. We'll also talk about concerns that come up for their caregivers. A lot of times this is family members, but I'm not going to leave you hanging. I'm going to make sure that you know about other options for care and ways that we can plan and ensure the safety of our loved ones. And we have Ken Tway with Center for Elders Independence to talk a little bit more about her program and what's available nationwide. So again, my goal for today is to not leave you hanging. I won't make you feel bad, but I do know the topic of our discussion sometimes elicits some emotions. So you may notice your feelings more after this presentation, but you'll walk away with some tools on how you can support yourself and your loved ones. Before I get started, in other circumstances, I would be in a physical space with you all. And so I want to know who's in the room today. I want to know your name, where you're from, and what has been the most difficult part of aging or caring for others. And I can start. So my name is Leticia. I'm from Richmond, California. And last year, my fiance and I was taking care of his aging mother who was dealing with a medical condition. And the hardest part was she didn't want to burden us. So a lot of times it was getting her to care a little bit later than we hoped for. And she had a lot of shame around needing support. And so it was really difficult to connect her to the right level of care because she felt like a burden. So that's a little bit about myself. And feel free to type in the chat if you want. But if you're ready to share, then you can just open your mic and let us know who you are.
Well, I guess I'll just go. So my name is Ken Toy, and I am an healthcare advocate and has been in the Bay Area for the past 13 years. I'm doing so in a different industry. And also the hardest part for me was not being able to live close by to my immediate family. And when my mother had a colon cancer back in 2014, and I was in a hospice industry working in the US and having all these knowledges, and then having to have the services available, but my mother is not in this country. So that really breaks my heart. And so I wanted to make sure that other family members that who I come in touch with or come interact with along my way of being a senior advocate, getting connected to the right resources and services available for them, so they will be able to utilize the services, that they deserve, and then it's provided in the community. So that has been my passions of being a senior advocate. So thank you.
Thank you.
I'll go. Start my video. So, I work with Ken and Myra. I'm a sales consultant, consulting with CEI and other branches that are affected by aging community as well. My experience, one of my things that touched home with this situation, my dad passed away suddenly, and my mom wasn't ready, and dad didn't set up mom, and it was horrible, and what she went through, and it was very difficult. And we see this happening all the time. It's getting worse, and it's going to get worse. Those kids of the 70s are in their 70s now, and it's coming. And so, this is such a vital thing that we're talking about today, and I'm interested in hearing what you have to say, because the need is ridiculous. With someone today, and they have no money. They have a ton of life in their body. They're vibrant, in their late 70s, and they're scared.
Yeah.
So I'm very interested in hearing what you got to say today, and thank you again for the invite.
Yeah, thanks for tuning in. A lot of times these conversations happen much later, and we'll talk about the period of time where people have these discussions. It tends to be in crises. And so we all know there's a beginning and the end. We're born and one day we will pass. And how we prepare ourselves for that can make the difference. And my goal is that we begin to have these difficult conversations and also pull together the resources that are available, making it more palatable and in a way that people can engage with without being so overwhelmed and intimidated.
Hello, my name is Deborah Smith, and I guess I'm going to be 68 this year. So my husband and I, we don't have children, so it's just like my husband and I. And I get concerned about him, and I'm pretty sure he's concerned about me as to who's going to take care of us.
Mm-hmm.
My dad passed away, and he was in a nursing home. So, but still having to go there and make sure everything was okay with him and visit with him and, tend to his needs and stuff. It was something that I really hadn't expected, because that's not something that I had ever done before. So I don't know. That's it.
Well, thank you for sharing. And that's why we're having this discussion, because there's an emotional component to aging and caring for those who have some different needs. Thank you.
I'll go next. My name is Sal, and if you can tell by the last name, I'm related to the host of this event. Good to see everyone. I'm interested in learning more about the subject. We're now in a position where we're expected to provide more care for my dad. He's 95 years old. There's a number of us siblings now that are stepping in to help out. And it's something new to us, but just certainly learning about resources, assistance, information that's out there is beneficial. So thanks for having this event. And it is very timely, very appropriate. And I see my sister on the line, so I'll also be helping her as she ages to take care of herself.
You guys behave in here. Thank you.
I can go next. Hello, everyone. My name is Myra. I work with Ken and Mark. I from the Bay Area here, Oakland. I have I'm kind of like the one in the family that knows a little bit more about resources, and now working with a service that pretty much helps seniors. I've learned that there's so much that the community don't know that is available. I my grandfather from my mom's side, he passed away, and he passed away with Alzheimer's, and my family was not ready for that. So now my grandfather on my dad's side, he's 86, going through a lot, and it's just like the family is going through a lot too, and just getting more knowledge, more information, and kind of being the support for them. I think these groups, it's really helpful. So
Thank
yeah,
you.
thank you.
Thank you. Thank you. A few more moments if anyone else would like to share. Again, you're free to add it in the chat if you don't want to open your mic to talk.
Well, I'll share. My name is Monte Baca, and I've had a lot of deaths in my family. It wasn't just because of aging, but for the most part, my brother was older, and I was a caregiver for him. I think more so, now that I'm in the aged category, I am more cognizant of what I need. To find out more about my preparation for if something happens. What do I do? So I'm tuned in for that, and thank you.
Thank you. I know my Thea tuned in late, but you're here. If you would like to share a little bit about yourself, the question is your name, where you're from, and what's been the most difficult part of aging or caring for others.
I think my name is Selma McQueen, and I think the difficult part of caring for others, this is becoming a trend. It seems like where baby boomers are caring for their parents because their parents are living longer.
Yeah.
And it's a challenge because we're already aging. Some of our body parts are not working as well, and yet we're having to come in and care for our loved ones. So that is becoming, I think, a challenge, but I think it's also becoming a large community of people that are going through the same thing.
Mm-hmm. Mm-hmm. Thank you. And that's why we're talking about it. From my side, working as a trauma social worker, I've seen a lot of folks come into the hospital. And so one of the biggest things around Older Americans Month is such an odd name, but I like to just say our Elders Month is acknowledging the matriarchs and the patriarchs of our families and the jewels and the uniqueness that they offer families. At the same time, the needs are very different than when you were a child and they were your parent raising you. And so we talk about long-term care. What does it look like when needs change and I need to rely on my friends and family, and I'm interfacing with the medical system a lot more than I'm used to? And so for some folks, aging is a gradual process. With others, it's a very abrupt process that also includes like managing multiple medical conditions, just like my Thea said. So as people age, naturally, there's some things going on with our bodies, where your mind, you can still feel young at heart, but your body may not cooperate as well as it used to. So when we think about what's actually happening, every 13 seconds, a senior is treated in the emergency room for injuries related to a fall. Now, these falls can sometimes be fatal, and sometimes they just result in non-fatal injuries. I've seen it several times in the ER and the ICU where, I'm sorry, can we mute our mics? Where a gentleman comes in, he's found down, he was able to get to a phone to call 911. He comes in, face busted up, lips so swollen, he bit his tongue, couldn't barely talk. And I have to find out information about him. So I'm getting his, his children's contact to let him know he's in the emergency. And he is like, I'm just so embarrassed. I'm so embarrassed. And I was like, sir, I have to go through the questionnaires around, do you use a walker or cane? He said, I just feel like an old person using that cane. And I said, well, look what happens. It's meant to be useful, right? So he's kind of laughing at himself around how difficult it is to use these assistive devices that are meant to keep us safe, but I wasn't emotionally ready to use them. So you find seniors falling in the bathroom, falling trying to get out of bed because their body is not cooperating as much as it used to. So these falls can come from carpets, you just trip over a carpet, stairs, just not getting your footing right. Sometimes it comes from poor nutrition, so not having enough meals. Sometimes it's vision loss and balance issues. So in the times that I've seen elder folks in the ER, they had a UTI caused delirium and it made their balance off. So it can be really complicated to really understand it, but a fall is really an important indicator that there's some needs there. When we look at the most common reasons that older adults go to the emergency room, one is fall-related injuries. The second are injuries sustained in a car accident. Now, I know you're thinking maybe, older people aren't supposed to be driving. Well, it's not that older people cause more accidents. It's actually younger drivers. But seniors, older people are more likely to be injured in a car accident. The third cause is medication mistakes and side effects. So sometimes older adults, they miss a dose, or they skip the dose, or they're taking too much, or they're not following up with their doctor when they're having side effects and symptoms, not communicating to the doctor to provide the appropriate dosage. So in those instances, you're going to want to make sure you're not feeling right. You're always keeping your primary care doctor in the loop. The fourth is heart-related emergencies. So heart-related emergencies result in 1.8 million ER visits by seniors every year. They seek medical attention for chest pains. So you may notice, oh, I'm having these sharp chest pains, or shortness of breath, noticing that you're getting more winded, for activities that tend to be pretty easy, like getting up and going to the kitchen, trying to get to the restroom. You're noticing that your breathing has become more labored, or exhaustion, just noticing you're completely exhausted. People go to the hospitals for those reasons. And it can be indicative of a more cardiovascular disease. So you definitely want to make sure you're using your benefits and keeping your primary care doctor up to breast of what's going on with you. The last, which is complications from diabetes. So folks who are living and coping or struggling to manage their diabetes don't always come in for some of the things that you may think. It could be things like ulcers, noticing that you're having wounds that aren't healing properly. It can be things like a stroke or heart attack. Sometimes it's dehydration, unstable blood sugar. So those are the 5 common reasons that older adults go to the emergency department. So I like to say this, and I know it doesn't always need to be said, but things are changing. Our bodies are changing because our cells are changing, our organs are changing. If you think about just the extent of time, where these cells have been working and working and working. And sometimes we don't always give ourselves the best things for optimal care, like sleep, reduce stress, proper nutrition, exercise, right? So you may notice as you get older, your bodily functions are changing. Even our appearance changes. As you get older, your ears get bigger because you need more radius to pick up sounds. Your nose may get a little bigger. And just, it happens. So I don't know that we've always talked about the aging process as much. And it can be really hard once you arrive to that point. So I would like to talk about the 5 stages of aging as it pertains to care. So Dr. Mark Frankel, he's the creator of the stages of aging. He says the first stage is self-sufficiency. So these are people who can live alone. They're managing their medical conditions, going to their doctor's appointments, and they're able to pay their mortgage and bills and, able to do hobbies around the house. The second stage is interdependence. So starting to rely on others a little bit more, like maybe your adult children, maybe your partner or spouse or friend. These are people you're asking to take you to the grocery store or do some light cleaning around the house, but you're noticing I'm needing some help, a little bit more help around the house. Stage 3 is the dependency stage. So you become dependent on help from others for what they call activities of daily living. So that's like cooking, cleaning, and shopping. Am I able to make a meal? And this stage, stage 3, people are not always forthcoming about needing more support around those areas. So we'll talk, I just want you to keep these stages in mind because you can see between stage 2 and 4, that's where folks find themselves in a lot of issues, and really an opportunity for us to start exploring ways to take better care of ourselves. So at the dependency stage, it may look like I can't get up and go to the bathroom. Then I may need to start wearing a diaper, or I may need to start having a bedside commode, having different things to make sure you can get your needs met. You're really relying on that. The 4th stage is crisis management. So these are folks where their physical health and their mental conditions have declined, where they are dependent of others. And this is classically folks who go to who have frequent hospital visits. With mental status, you may be having a conversation and it goes slightly left, where it's like, I think they're confused. If you ask what year it is, they say it's 1976. Not able to let you know what month we're in. Your physical health, you may start noticing, oh, they're a little bit shaky with their hands. They're writing something down and just looking off balance. These are folks who have increased hospital visits. At stage 5 of aging is the end of life process. So this is the time that folks tend to start seeking support. It's between stage 4 and 5 when there's a crisis happening and we're forced to make decisions. So it can be really complex. It can be really emotional. And most people want to disengage from it, create some space from it because I'm not ready, right? So I don't know anyone personally who has control over time, but a lot of these situations, you don't have the luxury of time. So having these really intimate and important conversations can make the difference between having a beautiful, dignified passing and a really stressful hospitalization, up and down, family issues. It can be really stressful and unnecessarily painful. So at this time, people are relying on hospice agencies, palliative care physicians to help manage. And these resources are really helpful if people ever even get to them. Sometimes folks don't even have the benefit of receiving hospice care. So when it comes to the person aging, the person needing more care, a lot of times the caregiving naturally goes to the family. And the truth is, at the end of my days, I want my family members over a stranger providing care. But you may think differently when your time comes. You may say, I don't want my kids looking at me. I don't want my kids in my business, or I don't want my kids bossing me around. For the caregiver, that can become a very strained relationship where the caregiver may have difficulty managing their time. So that can look like if you have if you have children, if you're working, it can be really hard to schedule time to provide that care. It could be if you have hobbies, or if you live far away, like how am I going to make myself available for my loved one? The other part is the emotional and physical stress. It's a lot of physical labor caring for someone. And you can't just say, well, hold on 1 second. Sometimes you have to, but usually the needs of the loved one who's requiring care are like immediate. Like, I need to get to the restroom. You can't really hold off on that one. With family caregivers, it's the lack of privacy. So the loved one, your aging parent or friend, may be living in your home and you're used to a certain level of like how I do things, or you're going to their home where you don't have the luxury of all the things you like, and the way you organize your days. Also financial strain, where sometimes it looks like you're taking time off from work to be available for your loved one. Sometimes it's they require more assistive devices. Sometimes that's not covered under your medical coverage, or paying for other caregivers for respite. The other concern and strain on caregivers is being afraid to ask for help. I've heard folks say, well, that's my parent. I don't want them to think I don't love them, or I don't want them to think I'm frustrated. And so they assume more responsibility than they actually have the capacity to provide. And so sometimes inadvertently, the loved one who needs more care gets neglected, not on purpose, but their needs exceed what the family is able to provide. There's also the component of depression and isolation. When you're using so much of your emotional energy on providing for that loved one, folks can start noticing more sadness, feeling hopeless about their own lives. So there's huge concerns around the people we're relying on, which is our caregivers. So when it comes to options for care, given that we know the aging process is inevitable if we are all lucky enough to make it into older age, what can help us? What ways can we begin to have these conversations and actually plan? Well, with Urban Health Group, I've created a Plan Well for Care course. This is an online course that helps people create their personalized plans. This is having these intense conversations. It's making your information known, and it's having a document that you can give your loved ones to say, I don't want you to guess when it comes to care if I should ever need more support. So I have a course that will be starting next month. I'm really proud of it. I really like it because a lot of times people who thought about it, those ideas exist in your head and it's not communicated to your loved ones. It's also building a community. So in our Facebook private community, folks are engaging. They are having these conversations and they're saying, I'm stuck at this point. But it's supportive, and we make sure that you get your questions answered. It comes with a workbook, and right now it's available in 2 languages, English and Spanish. If you want more information, by joining in, you will get a discount for being in today's meeting. The second thing that Urban Health Group provides is one-on-one support. You may say, I don't want to be in a classroom with people. I just want you to come and talk to me and know my unique needs. And there's 2 options. So crisis care, some people say, hey, my dad's in the hospital. They're saying he needs to go to a skilled nursing home. I would, myself or my other clinical care advisors, which are all mastered level social workers who are trained in healthcare, can help you and your loved one really create these plans, listen to your unique needs, and explore what services are available. And there's some people who aren't in the hospital but say, you know, I want to put some things in place to make sure that me and my honey or me and my husband are taken care of. So that's the advanced planning. You're planning for a time when things become more difficult. And at this point, I am very excited to introduce Ken Tway with Center for Elders Independence. I have had the privilege of referring, actually not referring, but collaborating with workers in the hospital. They provide wraparound services. They're really engaged with the individual and their families around coordinating care. And so I want her, I didn't know about this until working in the hospital. And so currently my fiance, his grandmother is a member of CEI, just so happened. And so we're really pleased with the care, but she's actually pleased with it. She's 92 and she's like, I wish I signed up for this years ago. But again, people don't always know about the resources. So I'm going to pass it over to Ken for her to talk a little bit more about what her agency does to support elders and their families.
Well, thank you. It's really emotional to always talk about, aging process, and thank you for bringing it very gracefully and touching everything. What Leticia earlier mentioned about the different part of aging and everything, it just really intertwined with what we do daily, connecting the resources to the senior as a part of the wraparound service. So I'm going to share my screen that has a little bit more of information on what CEI is, what kind of services that we offer, where are our locations, what are the criteria, to be a part of this organization, how can you contact us and things of that nature. So here it is. So Center for Elders Independence, we have been in the East Bay for the past 38 years, mainly in Alameda County, and recently expanded to Contra Costa County. So we are serving in 2 counties, and actually this program has started in Highland Hospital as an adult day center, and now it has become a full program of all-inclusive care for elderly as a national program that is created about, almost 40 something years ago, and we are one of the providers here in Northern California. And what it is that this service is about taking all-inclusive care for body, heart, and mind for the senior. So starting that, you have, as you can see, that you have a team of, interdisciplinary care that provided to you, which means you have a primary care, as Leticia mentioned earlier, more of a preventive measure, so you don't end up in the emergency, that always someone has been looking after for you and to coordinate the care that you need and have your medication delivered to your door. You have a transportation. One of the challenges that seniors started having is, I no longer be able to drive safely because of my neuropathy from my diabetes, my knees are hurting, or my foot are not really feeling as well and numbing, things like that. So we provide a safe transportation for all the medical appointment, whether it's coming to the center or whether you're going to your specialist or doctor's appointment to and from your home. And on top of that, we have a senior center that Monday through Friday, senior could come. One of the surveys that has said, a lot of the senior are deteriorating in their health is not necessarily because of their clinical needs, most from the isolation and not being able to have that socialization, and that's one of the things. So by coming to the center and socialize, and also being able to meet other senior about your age or having the same interest and having different activity, and that actually bring up a well-being of a body, mind, and soul for the seniors. And on top of that, we have a meal delivery service as well for senior who are really having the, not having the resources that connected to them, especially during COVID time, that we deliver meals to the senior, where else that they used to be receiving this hot meal and nutritious meal when they come to the center days. And on top of that, there's a caregiver program, meaning that we have the home care that goes to home, where that Leticia mentioned earlier that, when your daily activities, you started needing care of like, I am not able to, clean my home anymore. My body is not cooperating when my mind thinks that I wanted to clean the, do the vacuuming or whatnot today, but my body can't really follow and do things like I used to anymore. You're needing a little bit of assistance around the house for the chores, and that's a part of the program provided to you. And at the same time, sometimes seniors are worried that, hey, I don't speak English, I only speak Spanish, I only speak Chinese, I only speak Korean. We live in the Bay Area, which is one of the most diverse in the US, aside from East Coast and West Coast, we're on the coastal line that we live. We have a lot of seniors speaking different languages from different, background that they grew up with. And at CEI, we are a very diverse community with the staff member speaking different languages. And also, even if we do not, we have an interpretation and translation services available. For instance, for the senior who comes to the center on their clinic day, we make sure that there's an interpreter on site with them that accompany them for their doctor's appointment, so they can understand what the doctor is trying to tell them about their healthcare. If they're on the phone from home needing assistance, calling to the CEI center and saying, I speak Cantonese or Cantonese, Mandarin, we, as long as they tell what language that they speak, our call center and people are trained to connect them with 3-way or 4-way phone calls to make sure that they're getting help that they need. And so when they are becoming a participant, there is one point of contact for them. That will be a social worker assigned to them that will be getting the messages, or when they need help, they go to that one person, rather than saying you go to a doctor's office, that cardiologist, you need to call and make an appointment on your own, or that my Medi-Cal that I need to be renewing by the end of October, November time, and I don't know what to do in your leg, in your insurance and things like that. With us, there's a single one point of contact that you can contact to and have all the other things that you need that can be met, and also coordinate all your medical appointments for you. As I mentioned, you no longer need to call different doctor offices. It will be arranged for you. And also daycare, which is the center available for you to come. Once you are eligible for this program with either Medicare or Medi-Cal that you have, or Medi-Cal alone, there are no deductibles that you have to pay, such as, you may have a plan that now you still have to pay supplemental for insurance, or you still have to pay the prescription medications and things like that. Once you qualify for the program through Medicare and Medi-Cal, majority of the time, 99% of our senior who are currently on the program almost do not have out-of-pocket costs for any of the medical supply or medications or any services they need through this program. So if there is any, everyone, like if you have any questions or any point in time, please let me know, or I can have that after a few slides, and I can also answer all the questions as well.
One thing I like to add about this program, I mean, obviously I never worked for them, but coordinating care with them when their loved one was in the hospital. I remember having a Chinese family, and they were saying, like, my dad hates going to the nursing home because he doesn't like the food. And when you think about the later stages of life, food can be really important, having something that you can enjoy. So I remember CEI making sure dad got his rice every day. He wasn't asking for a lot, but that was really important to him. And so for me, the single point contact, sometimes we're scrambling for information, and we didn't have to scramble. they knew about this person. The family was not as confused. And, you know, there's still an emotional part where your loved one is maybe not doing as well as you like, but it wasn't as stressful. And a lot of times you see people having to repeat themselves and getting really tired of that. That was not my experience in collaborating care with CEI.
Okay, thank you for that. So let's go to see where are the CEI locations. So we are operated in 2 counties, Alameda County and Contra Costa County. In Alameda County, we are excluded for the Tri-City, which is the lower south of Alameda County, geographically for Fremont, Newark, and Union City. Those are by another organization called Unlock, operated in this area. And for CEI, we are operating in these 2 counties with 97 zip codes that was approved by Medicare and Medi-Cal, who are the federal and the state insurance system, and it's highly regulated. And making sure that we promise the PACE model is a national model that we are providing that very high level of wraparound service to the senior in these 2 counties. We have 5 PACE centers. There are 4 in Alameda County. There are 2, as you can see, if you look at it geographically from down in the south, starting from the Alameda County, is their San Leandro PACE Center, which is right across from San Leandro Kaiser. And we have in Eastmont PACE Center, which is in Eastmont Mall. And we have a downtown Oakland PACE Center on the 17th Street, which is right under our corporate building. We have a Berkeley PACE Center that at the corner of Alcatraz and Sacramento, which are the 4 PACE Center here. And we have 1 new center just opening up as of May 3rd, the first day of the operation, is our Concord PACE Center that we just opened up brand new. And on top of that 5 centers, CEI has Guardian Adult Day Health Center at El Sobrante, which the difference between that is for a full PACE center, you need to have a primary care clinic, you have a day center, plus a rehab therapy gym together. For Guardian Adult Day Center, there is only day center for the senior for socialization and activity. There isn't any primary care. However, this location does have a therapy room, may not have a treating therapist at all time compared to other center, but there are days that our participant in that location are getting services that they need as well. So these are our locations and in the East Bay for these 2 counties. Any question about the locations? No? Okay, so I will move to the other one and let's see who is eligible to join PACE program by CEI. So the program is for older adults with multiple medical problems who are in 55 years or older, need special care and assistance in their daily routine, which I can touch on a little more on the 5 stages of aging that Leticia just shared earlier. And so have a stable housing and want to remain at home because, as you know, like skilled nursing facility are not bad, but they're not the greatest place that you want to have your loved one or yourself at the time that you need a little more care than what you could do for yourself or deteriorating in your own healthcare want to be at. So when you have a home, you want it to remain in a home, a program like CEI for wraparound service is really a good start. And you have a payer source of who pays for this program. Medi-Cal or Medicare or Medi-Cal alone are the one who pays for it. And you can also privately pay for the program. And you live in the service area of Alameda County and Contra Costa County by CEI. Here, I would like to share a little bit on, by stopping this, but I wanted to share on another slide for the 5 stages of aging when it comes to how it applies to CEI, when it means that when is a good time to start looking into the services, to know that you're not alone, don't struggle on your own. There's help for you, reach out to people. So with that, I wanted to share this one slide about what are the stages that really for people to start looking into it. With what Leticia was sharing earlier about 5 stages of aging, is that when is the right time to look for a PACE program? The first stage, when Leticia mentioned about self-sufficiency, is where this implied to in this slide that you're looking at. It's too early for PACE or CEI program because you're still able to socialize well, managing your own healthcare, driving, doing a lot of things for your own. However, when it is a little too late is the stage of 4 and 5, why you started having crisis, that you end up in the ER visit, you're knowing that you're not able to manage your care, and you really are bedbound at the end of life, and you may be even needing more than you think. That's when people start looking for care. So then ask yourself, when can I get myself connected to help? Is where the stage of number 2 and 3, you started noticing dependency, that needing a little bit of care, a little bit of help, and then dependency stage of where you really are needing that daily activities of living, that you need help at home for someone coming to clean for you, not being able to call to doctor office and make those appointments anymore, started having, I don't remember if I take my medication today or did I take it this morning, things like that. You started noticing this, and this is when you started connecting or looking for the resources in the area, and PACE may be the right program for you. One of the things that really good with this program is that with CEI, once you are becoming a senior, a participant with this program, and as long as you do not leave the program, we take care of you or your loved one until they really passed away. That's the only time you disenroll yourself from the program, and we no longer able to provide service for you anymore. So with that, I would like to thank you, and then give the stage back to everyone and see if you have any questions about the program, anything that I could answer regarding the program and the services.
Yeah, thank you. The other part that I wanted to add is that CEI is the local program, but it's a part of a national PACE program. So even if you're not in, the San Francisco Bay Area, well, really the East Bay Area, that you can begin to look for these programs in your respective locations. They are nationwide. I don't know how readily available they are, but I do know that it's not only for Bay Area residents.
So I would like to share this and then provide a little more information. As you can see here on the screen, there are currently 139 PACE program and 272 PACE center in 30 states. This is a nationwide program by Medicare and Medicaid. In California, we call Medi-Cal, and it's serving about approximately 555,000 participants in CEI here. In California, we have 15 of the PACE program. CEI and Unlock are the nonprofit organization that serve in the Bay Area. And CEI is serving more than 850 participants, actually closer to the 900 now. And you can find it if you are sharing this information with loved ones who are out of state or who are in a SoCal. You can send them to PACE Finder, and by putting their zip code here, then you can find who are the provider in their area that they live and provide the same program to them, so that you can share this PACE program with your loved one from anywhere throughout the US, where they have 30 states that offer the services.
Thank you. I think I'm So now is the time that we want to just check in and see if you have any questions or thoughts after we've gone through our talk about keeping elders safe.
Leticia, I do have a question. Could you repeat the 5 stages of aging real quick again,
Yeah.
please?
I can actually go back. So first stage is self-sufficiency. Second stage is interdependence. Third is dependency. Fourth is crisis management. Fifth is end of life.
That's excellent. Thank you. It's interesting to see where people are in those stages. Yeah.
Yeah. And we don't always think about that. Folks are, I think, just managing. You're doing the best you can. But sometimes when you have this information, you say, oh, I'm at that stage. This is the time where I get more help. Oh, I notice I'm starting to, for the caregivers, I'm starting to struggle with managing my time and I'm feeling down and hopeless. This is the time to look for more resources for my loved one. We don't always use those clues of discomfort and stress as really good signals to seek support. And we don't always know what support's available. So I really like the position of my company that's not connected to a hospital that tends to provide these resources in a crisis. We're given this information ahead of time. So for the folks who are baby boomers and you're not there yet, you can even begin to start thinking about for yourself. For myself and my peers, we have aging parents who we're starting to think about. And I've had some friends who are also caregivers to say, what can be done? What can be helpful? And it's not the traditional nucleus family where everyone used to live close together. Things are a lot more spread out. And so access to really good information, sometimes it's hard to find until you're in a crisis situation.
Exactly. I would like to second to that by saying, here in the US healthcare system itself is very complex. On top of that, there are so many options out there, and sometimes depending on what your situation, your loved one situation is, finding the resources that's out there and to be connected with the one that is best suited for their situation can be a strenuous process. Along that process, you could get lost. Along that process, you don't know where you need to start, and then it's just really hard. So always knowing where you can go and get connected to, or at least having someone and say, hey, Leticia, this is what's happening with my family. Can you point me to the right direction, or can you connect me to their resources? It always has been, the greatest thing that you could rely on someone that in the community to get you connected or point you to the direction that is what you're going through with you and your family.
Yeah.
Any questions from other folks?
Any thoughts coming up?
Well, I had a question for Ken, and this is Sal. Looking at the PACE Finder and specifically looking at the Central Coast in California, there is not a PACE program between LA and the San Francisco Bay Area along the coast. Are there similar programs that provide these same services?
So which area is it? Like exactly say which part of the coast?
Yes, Santa Barbara County.
Santa Barbara, it should be, because in Santa Barbara, the closest will be, I want to say in LA County, there are a lot of the PACE program that is in the area. So I wonder if they would serve the area.
Okay.
What is the company? Mark, do you remember what is the agency that Maria comes from? Ultimate is in LA County. So LA County and Santa Barbara are not far from each other. So I wonder they may have in that area as well. They're a pretty big organization.
Okay.
There are actually more PACE organization in Southern California than compared to Northern California.
Sure. I'll follow up with Ultimate. Thank you.
You're welcome.
In that case, Ken, could you, like, let's say someone calls you and their loved one is out of your service area. Could you make that connection? Like
We
find out-
are able to at least say, you know, by Pace Finder. So what we do at CEI is not only that we provide the services, we make sure that, you know, we also are helpful and being resourceful for people who come to our direction, be at least point them to where they could go to. With that, we will say what's your zip code, or who is, you know, the zip code that your loved one you're trying to help, and we will give them information. For instance, Pace Finder, let me give you a little demonstration here. What it will pop up, so that really we utilize this very often in our own, you know, say, Sal, can you give me the zip code of someone that you were trying to help earlier?
Yeah, 93434.
93434. And so just by typing in, we will look for, see, elder locator for the website. So this is where, let's see what it will take us there and who is going to be there. This one doesn't look like they have it. Let me refresh.
Can you show us so we can see where you?
Oh, I'm sorry. Am I showing that to you or no?
we could see it now.
Okay.
Now,
So for instance, I know in the Fresno area, right? Let me check, or Ultimate. Just trying to put a zip code there and it's just having a hard time. 90033.
That's good.
94 or 95? 90033. 0033. So there is an ultimate pay center. So we know that in Los Angeles, in that area. So maybe Sal, the person that you have is in Santa Barbara, may not have that in the area. Yeah.
Well, right. I think the question is, are there other programs or other resources that that you could connect someone to, that maybe it's not same pace, but like same type of program?
I am not, I don't think there is a program like this exactly. However, depending on the senior's condition, we would say, you know, this could be some of the solution that they could look into. For instance, what kind of insurance do they have? Do they have a caregiver coming to them? Say if the senior have Medi-Cal, then contact the social services and have an in-home service support coming to them, which is another way of having support coming to you without having to pay out of pocket or meeting a small amount of share cost or spend down money that they need to use, you know, to utilize that Medi-Cal benefit.
So it doesn't exist everywhere, it doesn't cover all programs, but maybe there may be someone in the office who could point you in the right direction. I think that's what I'm gathering. So go ahead.
I was wondering, because a lot of times they're rural areas, and we've got the privilege of having a lot of services in the Bay Area, but there are things with particular counties.
Hold on, sorry.
And I think
there's some feedback, so I'm gonna mute everyone who's not talking.
Okay. I think that sometimes when they're more rural areas or not like, you know, metropolitan areas, there are still kinds of agencies that are basic because of Medi-Cal, people having like hospice and in-home service care. So it would be good to connect with those kind of agencies to find out what services are available. And I think it's really helpful with the is it CEI to be able to help a person to find out what questions can they ask.
Yeah.
You know, those things are really pertinent to care because caregivers, like you said, families take on a lot, but because you don't know what's available, you haven't had to reach out for those kind of services. But each county, although it may not be the wraparound services, each county has some type of care, and it's helpful to know what questions to ask.
Right.
And so it's CEI, you're able to call and maybe ask.
Well, I
for
don't
that
know
kind
that
of
that's a CEI thing, but it's an urban health group thing. So we could
Okay.
work with individuals to explore what resources are available and provide care plans. So sometimes people are relying on family, but that's part of our one-on-one supports, is that we would go through each of the needs and devise a plan with you that would work, given the resources that are available in your local community.
Okay, great.
So we are at time. I want to thank everyone for joining. If you have questions about anything that we talked about, if this spurred some more questions or thoughts, or maybe some people popped up in your mind around, dang, I think they might need some more support, or I would want some more support for myself. This also comes up for people who live alone, who don't have adult children or don't have a lot of support system. We know with COVID-19, people's support systems have gotten really sparse due to folks taking care of their own needs. So we would like to support you. If you need some support, we can talk about our plans that we have available, but please take care of yourself, take care of your loved ones, and there's ways that we can keep our elders safe. So thanks for joining in.
Thank you, and good job, Letty.
Thank you.
Well, thank you, everyone. Have a great evening.
Thank you, Ken.
Thank you,
Thank you.
Leticia.
Bye-bye.
Bye-bye.
Good night,
Bye-bye.
everyone.